Rebecca Trimbur. Hello, everyone. My name is Becca, and we are going to be looking at Chapter 1 of Pathophysiology. We are going to go over a lot of topics, but first we are going to start with disease. Disease is an illness or a malformation that causes any kind of dysfunction in an organ system, or a body as a whole. They can be categorized many different ways, but some of the big ones are by organ. So you can look at liver diseases as a group, or it can be looked at by cause or etiology, which can be a virus causing this disease, like a norovirus. We are also going to be looking at pathogenesis of the disease, which is the progression and then either the resolution or the continuation in a body. So if we were looking at a norovirus, like we talked about before, what we are going to see is the virus infect the patient. It is going to start replicating in the body. You're going to see those numbers grow, and then the body is going to have an immune response to it. So it's going to start fighting the viruses, killing them off, using macrophages to swallow them whole and excrete them from the body. And once you see the immune system response at its highest peak, that's when you will see symptoms start to go down. People will lose their fever, they'll start to feel more normal, and then they will go back to their regular function. Now, I just talked about symptoms. Symptoms are actually subjective. They are going to be things that your patient tells you about. So it's going to be things that I can't observe, but that they tell me they are feeling. So this is going to be things like fatigue or muscle aches, things like that, things that I can't really verify, but that they can report to me. Signs, on the other hand, are going to be things that I can observe or I can test for. So this is going to be things like I can see that they are diaphoretic, right? I can see that they go pale. I can see that they get sweaty. I can also test for a fever by using a thermometer. That is going to be another sign of an infection or a disease. You can have a marrying of both of these things in what we call a syndrome. So if we look at serotonin syndrome, I can see certain signs like profuse sweating. I can see that the pupils are larger than normal, they're dilated, but the patient can also report that they are having confusion, they are having fatigue. So it is a mix of signs and symptoms for a syndrome. Often with a disease, you will go to a healthcare practitioner and then you will have diagnostic tests run. So this can be anything from a blood test where they look for troponin levels to see if you have had a heart attack either now or had one in the last few days. They can look to see if those troponin levels are elevated. Or they can have you maybe do a breath test to see how strong your lungs are, and they can diagnose you from there. Diagnosis is going to be when a healthcare provider runs tests and then they give you the disease or illness that you are experiencing. So they are going to be able to run these tests. They're going to see those troponin levels and say, hey, you are having a heart attack right now. Now, they can go from there with treatments, but first is the diagnosis of the disease. Complications would be anything that is unintended or a bad side effect of the disease itself. So if you have atrial fibrillation, right, your right atrium is not contracting correctly because of the electrical signals. So instead of contracting and pushing all of the blood or most of the blood into the right ventricle, what it does is it almost pulses. And basically what happens is that the blood will circulate and then make a little tiny blood clot, and that blood clot can then be expelled, pushed through the circulatory system, and then once it gets up to the brain, it will cause a stroke, and that's a complication from atrial fibrillation. Stroke can happen, and then you might lose some function of one half of your body, and it might not be curable, it might not be fixed by any kind of physical therapy, and that would be a complication of the original disease, atrial fibrillation. And all of this basically runs down to the disease, the prognosis, the diagnosis, and then how your healthcare provider is going to treat it. I'm looking forward to the rest of this class, and I hope to see you guys soon. Thank you.